Good morning. My name is Heather Cox, and today we're going to talk about IV piggyback medications. The first thing I'm going to do is talk to you about the different types of equipment and things that might be needed to administer the IV piggyback medications, and then we'll actually go into the skill portion. If you look down at the table with me, I'm going to show you some equipment that's necessary. The first things I'm going to show you are your actual drug references. And so if you look here, I've got a couple of different references. One that you might use might be the Davis's Drug Guide for Nurses, or you could actually use an intravenous medication drug book. Now certainly you'd have one that's more up to date than this. So your Davis Drug Guide is probably up to about 16th edition by now, and certainly for the IV medications you'd want one that was 2015 or 16 by this point. You always want your drug resources to be as up to date as possible. Some other resources that you guys could use would be LexiComp at the hospital, or you could use Lippincott Advisor or any other drug reference that you guys have. Whenever you are looking up your medications, there are certain key points that you'd want to note whenever you're looking up your medications, whenever you're doing IV piggybacks. So I'm actually going to turn in here in the book, and the way most of these work, there is a table of contents at the front that could help you, or you can actually go back to the index and look your medication up alphabetically. So one of the first things you're going to note here in your drug resource is going to tell you the name of the medication, and it's going to tell you what classification it is, and then it will give you generic and trade names. You're always going to want to look at the usual dosage section because you want to know if your dosage is safe and what you think the dose might be used for, and you're going to correlate this with the right reason for the patient if they're getting this. Then you're going to come on down here and you're going to see if there are any dose adjustments, for instance, for pediatrics, or if you've got elderly, or if they've got kidney issues or liver issues. Another section we would look at would be the dilution, because whenever you have a medication, if you're doing IV piggyback medicines, typically they're going to come in a vial like this. And so I'm not going to be able to give this powdered solution to the patient. I'm going to actually have to reconstitute it where I mix it up with a solution and I cause it to be diluted. So when you look at the drug reference, you would need to look at the dilution so that you would make sure how much you have to dilute it with, and then also what it's compatible with, and that's the next section. So the dilution is going to tell you what liquid you have to mix it with, either normal saline or dextrose, or if there's other things that you need to mix it with, and the amount so that you get the right concentration strength, because if you have it too concentrated, then you could cause issues with the infusion, and you could cause issues with the IV. Compatibility tells me what it can hang with, so I might have some other types of fluids that are hanging. It could be that I have additives in the fluid. So for instance, not only do I have normal saline, but I might have potassium in that normal saline. And I would look here to make sure if the medication I was administering, IV piggyback, was compatible with that potassium that's in the saline that's infusing. The next section you'd want to look at here is the rate of administration, and this tells me how quickly that it can actually infuse. Typically your IV piggyback medications are going to infuse anywhere from 10 to 60 minutes, but you'd want to make sure in here that you have the appropriate time, because if you give it too quickly, some medications can have major side effects like drop in blood pressure, rashes. You could cause infiltration of the IV, and there's other issues. And then if you moved on through, you could see the action of the medications and if there's any contraindications or precautions. And then they have side effects of the medications, and then if there are any antidotes for the medicines. The main sections that you would be concerned with here, though, are the usual doses and dose adjustments, dilution, compatibility, rate of administration, and then you could look up anything else that you needed. Now this is set up specifically for this IV medication book, but you can look the same things up in your actual Davis's Drug Guide, which contains your PO medications as well, and you can also look it up in LexiComp, Lippincott Advisor, various other resources. So once you've gone through and you've looked at your medication and you know what you're supposed to mix it with and all that, I'm now going to move you over here and show you some of the things that you need to actually mix the medication. So when we looked it up, you knew it had to be diluted. And when you look up the dilution, you would know what the diluent needs to be. And in here I've got sodium chloride, which is your normal saline. And if you'll notice, this one is a 50 milliliter bag. And then if you'll notice on this one is a 100 milliliter bag. Now you've also got dextrose that comes in this same manner. If you look at this one, and there might be a little bit of a glare here, but this one is in the package, And if you'll notice, it's 0.9% sodium chloride, so it's normal saline as well. And then if you look at the amount, this is a 250 milliliter bag. Now, dextrose also comes this way as well. So when you've looked up what it needs to be diluted in, you would need to pick the appropriate diluent and amount. You can always dilute it more than what is required, but you can't dilute less because then you would have too concentrated of a medication. So we would pick this based on what the package insert says or off of the drug guide that you've looked at. You always need to make sure that you've labeled your medication once you've mixed it up. And so we would have a label here that would actually go on the back of the bag. And the reason I would put it on the back here is because I still need to be able to see up here on the front that this is normal saline and the amount. So once I get the label filled out, it would need to have the patient's name and any identifiers on here. It would need to have the medication and the dose and the route and the date and the time and your initials. And you could just put the sticker on the back of the bag once you mixed it up. The other label I've got here is the sticker for the actual tubing that you're going to administer the medicine with, because remember, your tubing always needs to be labeled. Now with this one, today is Tuesday, so I've got to change Saturday sticker here, because if this is infusing and it stays hooked up and it's continuous, then most of your agencies say that it can hang for 96 hours. But always make sure you check your agency policy, because if they're intermittent antibiotics, they may not be able to hang the tubing for more than 24 hours. If you don't have a securement device, it may be 72 hours. If you do have a securement device, it may be 96. So always check your IV policies to see how long the tubing can hang for an IV piggyback medication. To finish up the rest of the actual reconstitution portion, we have actually over here a couple of spikes. And if you look at these, I've got two different colors. I've got a green and a white. This green is used for the 50 or the 100 milliliter bags, and then the white is used for the 250 milliliter bags or larger. And I'll show you the reason for this. Whenever I take this apart, there are two different ends here. And what we use these spikes for is actually to spike the vial of the medication. So when you have the vial, you're going to come through and, make sure it's the right medication, the right dose, the right route, the right time, the right patient, the right documentation. You're going to go through and verify all your rights of medication administration. You're going to do 3 checks since this is a medication. But what's required is the actual diluent, the spike, and then the medicine. So I'm going to use the little one here and just show you what it looks like. To open this up, you actually twist it. And when I twist it, this is the spike that actually goes in the medication. So what I would need to do is I would need to take this spike and go over here to the medicine, and I would need to pop the top. Once I've popped the top, I'm now going to come over here and grab an alcohol wipe, and I'm going to swab the top of the vial here for 30 seconds. And we'll say it's been 30 seconds, and then I would allow it to dry. Now once it's dried, this spike actually goes down in the top of the vial. You need to put it right in the center of the stopper, and be careful because this thing is a little sharp, and if you'll notice, you can see it has a graduated spike here. So what I'm going to do is take this in my dominant hand and the medication's in my non-dominant hand. You could actually put it down on the table if you wanted to, but typically I hold it. It goes right in here, and you need to spike it until this comes down and hooks over the top of the actual vial. Now I can pull this off, and I'm going to show you here, there is a short needle in this one. And if you look at it, you can see this needle is shorter. If I had actually used the one for the 250 milliliter, the needle is about twice as long here. And the reason for that is because if you look at the 50 and the 100 milliliter bag, it's a shorter section that has to actually be spiked. Versus if you look at the 250 milliliter bag, it's a longer section. So when you're using the 50 to 100 milliliter bags, you're going to pick the green top. If you're picking a 250 milliliter or larger, you're going to use a white top. And you'll just have to look at your facility policy and look at the equipment that you actually have here to know what you're going to use. So now I'm actually ready to spike one of these bags. And what I'm going to say is that my drug resource said that I need to mix this medication up with 100 milliliters of normal saline. So when you look at this, you can see here says add and here says set. So if I'm adding, I'm actually adding the medication, and then this is the port that I'm going to spike to mix it up. The set is where I'm going to actually put the IV Piggyback set once I've got it mixed up. But please remember, you must mix your medication and have that completely done before you spike this with the set, because if you don't, then you'll lose half of your medication before it's diluted and done what needs to be done. So I'm going to come over here to the add port, and I'm going to pop this lid off. And if there's any chance that I touched it, or you're worried about that in any way, then you want to go ahead and swab this for 30 seconds. And we'll say it's been 30 seconds. And once the 30 seconds is done, you now need to let it air dry. And once it's air dried, I'm now going to come over here, and if you'll notice, it won't fit this way because this is going to actually hit the bag. So I have to turn it to where it will fit around the bag, and the needle is actually going to spike through the stopper in the bag, and now I am spiked. Now I have to actually mix the medication, and I mix them back and forth, and then I get the medicine back up in here. So the easiest way to do this is to take the bag and kind of flip it in half in your hand, and you squeeze. And you will notice that when I do this, there starts to be liquid coming down here in the actual powder. And you see I'm just kind of squeezing and releasing. And as I'm doing this, I'm also going to go ahead and agitate the medication. And this is the Reconstitution portion of this that I'm doing, because what I did is I forced the diluent down into the powder. And now I'm actually mixing up the medication. And once you get to the point that you think the medicine is mixed, then you can actually invert it. And if you'll see now, I'm going to squeeze on the bag, and you will see the medication begin to come back down here in the rest of the normal saline. And what you do is usually squeeze and release. And you see I have to do this until all of this medication comes out of this vial, because I don't want to lose any of the medicine that I'm reconstituting. Now, if you find that you've still got some powder in here and it's not mixed up, all you have to do is invert it again with the powder down. Take this and kind of turn it in your hand halfway and squeeze, and the liquid will come back down into the vial again. You can agitate it again, and then again invert it, and you can squeeze and release, and you'll see the liquid begin to come back down into the Piggyback bag for the medication. Now I want to try to get this with as much of the medication out of the vial as I can, and sometimes you'll have issues because there's a little piece in here that was between the stopper, and if that gets caught in there on the spike, then it can cause you to have issues with getting all the medication down. So once I've got all the medication back out of the vial in here into the normal saline, I am now reconstituted. So if you'll look here, again, I've got the right medication, the right dose, the right route, the right time. I'm going to verify the right patient, and I've got it mixed up in the proper diluent in the proper amount. So now I have actually diluted my medication. Now would be the point where I could go ahead and put the label on with the patient information and the date and time and the medicine and the amount that it's mixed in and all those kind of things. Now that I've got this mixed, I certainly can't let this out of my sight because this is the medication for the patient, so I would need to make sure that it's here with me. I'm going to show you the actual tubing here that we would use to administer this. And if you'll notice, it says secondary IV set. And if you look at it, you've got the 15 drops per milliliter. You're going to make sure your package is clean, dry, and intact. You're going to check your expiration date, all the stuff that you normally do for any of your IV therapy. So I'm going to go ahead and open this up. And once I've opened this, I'm going to show you the equipment that's in here. So if you look here, there's actually two pieces that come in the IV secondary or Piggyback set. There's going to be an actual hanger here to where I'm going to use this to lower my primary bag and raise my secondary, and I'll show you why here in a little bit. And then I'm actually going to have a set of tubing here. Now, as I said in your IV therapy video that you previously watched, the first thing you always want to do when you take tubing out of the pack is go ahead and clamp the roller clamp. That way you don't end up losing any of your medication, you don't end up with air in your line. Now there are certain pieces on this line that are going to have to stay sterile, just like with your primary IV tubing. So they've got a cap here on the spike, and the spike must stay sterile. And then they've got a cap here on the end, and the tip of the end must stay sterile. So I'm not going to uncap anything at this point. When I have gone through and I have verified, I've got the right medication, dose, route, time, I've done my 6 writes and my 3 checks, I've scanned my medicine, I've scanned my patient, I can go ahead and go through and I can take my spike and take the cap off. Of course, I would have done hand hygiene and everything before I started. I'm now going to come over here to the set, and I'm going to peel this little metal piece off, and I need to make sure that I keep the inside of this set portion spike sterile as well. I'm going to come back over here and hold this and take the spike while keeping it sterile, and I'm now going to come and spike the actual bag. Once I've got it up there to the indicator line, I can now come down and I can fill my drip chamber per policy, 1/3 to half full, more if that's what's required. Now there are 2 different ways of priming this tubing. I could go ahead and I could open up the roller clamp and I could prime it all the way down here to the end, and now my line would be primed. There is a second way to do this, and it's what we call back priming. And I'm now going to move over here to the IV pump, and I'm going to show you how to do that. So I'm now going to enter the patient's room, having looked at everything outside of the room, including the doctor's order and the need for the medication. I've correlated what the medicine is and the dose and the route and all those things outside of the room. I've also checked the patient's allergies outside of the room and incompatibilities, the order for the primary fluid, if there is primary fluid going, and that there was no question about the order. If there were, I would have clarified any inconsistencies. So I'm going to go ahead and foam as I'm entering, and I would knock on the door, and I would pull the curtain and provide for privacy, and I'm going to go ahead and perform AIDIT and speak to my patient. Good morning, Mr. Shapiro. My name is Heather, and I'm going to be your nurse today. Can you please tell me your name and date of birth? And as he tells me, I'm going to come down and look at his armband, and I'm going to confirm his name and his date of birth and that there are no inconsistencies. And Mr. Shapiro, could you please tell me if you have any allergies, sir? And he says he has no allergies, and I'm also going to check his armband here to make sure that that's consistent. I would have already checked with the chart outside to make sure there were no issues with allergies or any of that thing at this time, too. Mr. Shapiro, I'm going to be in here probably for about 10 to 15 minutes because the doctor has ordered for you to have an antibiotic. Have you ever had any reactions to any antibiotics in the past? And it's important to ask, especially with antibiotics, because that's usually what your IV piggybacks are, because there can be issues with allergies, and possibly they didn't remember those as an allergy and they've had some issues with it before. Mr. Shapiro says he's had antibiotics before, he's had no issues, but you always want to make sure that you perform assessments throughout the administration of the medication to make sure you don't see any sign of anaphylaxis or allergic reaction. Now, the next thing I need to do is explain to him that I need to assess his IV, because you need to make sure you have a functioning IV before you can hang an IV piggyback medication. Mr. Shapiro, I'm going to take a look at your IV here for just a minute before we give you the antibiotic through your IV, okay? So I'm going to come down here, and if there's any question that you're going to have to do anything with the IV, then you would need to have gloves on. If you can actually look at it and assess it and you're not worried about that, then you can get by with doing the IV piggyback without gloves. But if there's any question, you need to make sure that you wear them. So if you remember from your IV therapy that we need to assess the IV, and what you're looking for is to see that if it's infiltrated, and with those signs and symptoms you would probably see swelling and coolness, and the patient may complain of pain. If I'm worried about phlebitis, then I would be looking for redness or streaking up the patient's arm. You may have heat, you may have pain, and you could potentially have some swelling there as well. It could be infiltrated and have phlebitis as well. So I need to look if it's date, time, and initialed, and if the gauge is here, and if it's within the time frame for your facility that the IV can actually infuse. I need to make sure that the tubing is attached to the primary tubing, follow it back up, and make sure that it is unclamped. And then I would follow back up here to the actual IV pump, and I would perform assessments at this time. Again, if there's any question that you're going to have to do anything down here with the IV, you would make sure that you need gloves on at this point. So now I'm going to move up here to the actual IV pump, and we're going to look at this and assess what's going on with the IV pump. And now we're over with the pump, and we're going to assess the primary fluid and make sure everything is what it needs to be here with this. So if you come up here, I'm going to look at this, and you'll see I've got 0.9% sodium chloride. So basically Mr. Shapiro has normal saline infusion. I would need to make sure that there is a label here on this bag so that it shows when it has been hung. and that it is within the facility policy that it's okay for this to be still infusing. I also want to watch the drip chamber to make sure that it is actually infusing. I need to make sure that the tubing is labeled and that it is within date. I would follow it back down to the pump, and if you look at this, you can actually see that his normal saline is infusing at 100 milliliters per hour. I can follow the tubing back down to him again and just make sure everything is what it needs to be for the primary fluid that is infusing. Your patient may or may not have primary fluid going when you go into the room. Most of your patients will, and we're just going to hang the IV piggyback off of that fluid as long as you've checked compatibilities. If they do not have primary fluid infusing, then you need to look at your facility policy to see how you need to hang it if there are not primary fluids infusing. So at this point, I have assessed Mr. Shapiro's IV. I've assessed his primary fluid. Everything is as it's ordered, and I know that this fluid is compatible because I checked it whenever I was looking up the medication that was ordered. At this point, I would go ahead and have the computer up, and I would have gone through and scanned Mr. Shapiro to confirm who he is. I would have the medication screen up on the computer, and I would have gone through and done the 3 checks and the 6 writes with my medication. And then I would need to scan the medication first, and then I would need to scan Mr. Shapiro before I administered the medication. So I brought this equipment in here with me, and you'll look, it's the one I've already pre-mixed. So again, it has already been diluted, it's already been labeled, I've already got the drip chamber partially filled, but I'm going to go through and show you how to back prime this medication instead of priming it straight way through, okay? So the equipment I would need, I'm certainly going to need the hanger so that I can lower the primary fluid. I need the medication. I've got the secondary set. I need some alcohol here because I'm going to have to swab the port where I hang it. And then I've got some labels here where I can label my tubing whenever I'm finished. So the very first thing I'm going to do, I'm going to set the medicine down here on the side for just a minute. And I'm going to go ahead and lower my primary fluid with the hanger. And the purpose for this is because of gravity. Whatever is hanging higher is going to be what's infusing, and I'll show you that once we get everything hooked up. Now, if you'll look at this, I've got one port above the pump, and this is the port that you always hang your piggyback medications on if you want them controlled by the pump. And IV piggyback medication should be regulated by the IV pump. If I was going to give an IV push medication, I would actually come down to the port closest to the patient because I would be controlling the time and the amount that I'm giving for an IV push. However, we're administering IV piggyback, so we always want to come to the port that is above the pump so that the pump can regulate the flow rate. So at this point, I'm going to come over here and I'm going to grab my secondary medication and I'm going to go ahead and hang it up here. And you'll note that since I have the hanger, I have lowered the primary fluid. The piggyback is now hanging higher than the primary fluid. I've still got my tubing clamped because if I didn't, this would be free flowing out onto the floor. I'm now going to come over here and I'm going to grab an alcohol wipe and I'm going to come to the port above the pump and I'm going to swab this port for at least 30 seconds. And we'll say it's been 30 seconds, and then I need to let it air dry. Now, occasionally when you come into the room, you may well see one of the swab caps put on here, and that is an alcohol-impregnated cap, and that might be because we're using piggybacks off and on just like we might do with the saline lock. At this point, I've swabbed it. It is dry. I'm going to take the end off without contaminating this piece or touching that. I'm going to take this and push in and twist to the right, and I now have my piggyback or secondary hooked up to my primary tubing. At this point, I'm still clamped, so what's still infusing will be the primary. What I need to do is I need to unclamp this, and I'm going to lower my secondary bag lower than my primary bag. And what that will do is force the primary fluid back up in here and then prime my secondary line. And this is what we term back priming. So you can do this either way. You could have primed it before you attached it and your line would already be primed, or you could have filled the drip chamber and you could hook it up and then open this and lower it and it will back prime. So what I'm going to do is I'm going to take this off and I'm still clamped, and if you watch when I unclamp this and lower this lower than the primary, this will begin to run very fast because of gravity. This is going to be down lower and it will fill this line, so it will force all the air back up in here into the drip chamber into the bag. So I'm going to go ahead and unclamp it. And once I do that, I'm going to go ahead and lower this down, and you will see the fluid filled all the way up the line, and you see it's filling the drip chamber. Once I hold it back up higher, now I can take it and put it up here, and you will now note that this begins to infuse. Before I let this infuse, I'm going to go ahead and pause my pump, and I need to come and set the pump so that this will infuse at the proper rate. Now, this is the part where you would need to have done your calculations to know how quickly this can run. If you look at this, this bag is 100 milliliters. So if in your drug guide or drug resource it said that you needed to infuse this over an hour, I've got 100 milliliters, which will infuse over an hour, so it would be 100 milliliters per hour. However, if it said that it needed to infuse in 30 minutes, then I would need to do some math calculations, and I'm going to show you how to do that here at the end of the video. If you think about it logically though, if I know I need to infuse 100 milliliters in 30 minutes, I'm going to infuse it twice as fast. So if I had 100 in an hour, it would go at an hour. If I have 100 in 30 minutes, it's going to go in twice as fast, which would be 200 milliliters an hour. So let's say I want this 100 milliliters to infuse in 30 minutes. What I'm going to have to do is come over here to the pump, and I'm going to have to program it into the pump for it to infuse. So at this point, I'm going to use the up arrow, and I'm going to tab up to Special Functions. I'm going to tab over, and it brings up a new menu, and you'll see Piggyback mode. I need to tab down to the Piggyback mode and tab over to get into that. It's going to ask me, do I want it to automatically change? And yes, I do, because what it will do is it will convert over from the piggyback or secondary rate to the primary rate once this is completed infusion. So I'm going to hit the up arrow for yes. You could use the drug library at this point if you wanted to. Some of these medications are in there and it'll walk you through and prompt you how to do it. I'm not going to do it at this point, so I'm going to hit no. And I'm not going to use a dose rate calculation. Those tend to be more for your drips. So I'm going to hit no for that. Now it's asking me for what my volume to be infused is. I'm wanting to infuse a full 100 milliliters for this piggyback or secondary medication. So I'm going to tab over to the hundredths place and go up to 100 and hit OK. Now it's going to ask me what my rate is. So I'm going to hit the over arrow, and I would have had to have done my calculation. So as we said, I want this to infuse in 30 minutes, so the rate is going to be 200 to get 100 milliliters in 30 minutes. So I'm going to tab over to the hundredths place and go up to 200 and hit OK. And now I am actually ready for the medication to start infusing. So what I'm going to go ahead and hit is start. And once I hit start, you'll notice that the piggy is highlighted, which means the piggyback or secondary is infusing. You'll see the arrows going, which means it's infusing. You'll see the rate of 200 milliliters per hour. And if you look over here, it will tell you that I've got this down for 30 minutes. So it does go back and double check behind you whenever you're doing your math, but I will show you how to do the math. Before you leave the room, always make sure that you note that the piggyback is the actual one that is dripping, because most of the time what people will forget to do is unclamp this, and then what will happen is, based on gravity, if this is clamped off, this is going to infuse at the rate that you set your secondary or piggyback for. So I know it's infusing. It probably would be a good idea to stay with your patient for about 10 minutes if you can, to see if this gets down to the patient and make sure that they're not having any allergic reaction. If you can't stay with them right at this minute, then you need to come back and check on them in about 15 minutes to see if they're having any issues. I would certainly need to do some education with Mr. Shapiro about the medication so that he knew what he was getting, why he was getting the medication, and what kind of side effects to look for, so if he has any questions, he can ring the call bell and get up with you if there are any issues. Now, this is going to take a full 30 minutes for this to infuse. So what I would need to do is, once this is done infusing, I would come back into the room and I would need to make sure everything is infused. And once it's done, I would need to clamp off the secondary, and I would need to raise the primary back up higher so that this is clamped and I won't have any issues with actually infusing. If this is unclamped and it falls lower than your primary, the primary fluid can actually backflow down into the secondary, and it can cause this bag to fill up and it could burst. It can also cause blood to back up down your patient's IV line because I have nothing infusing in them and it's not clamped off and everything's infusing in this secondary line instead that's fallen. So it's very imperative that when it's done, you clamp this off and then come back in and raise your primary back up to the height that it needs to be. You also then need to make sure that the pump rate has flipped back over to the primary rate and that everything is infusing as it should be. So in this, we've gone through and we've talked about how to reconstitute your medication and how to spike it and make sure everything's compatible. We've gone through how to assess the IV site again and how to actually hang a secondary medication and make sure that it's infusing. You always want to make sure that you're doing your IV assessments as indicated by your hospital policy, but you certainly could come back in and do them more frequently if you needed to. So I've now got this medication hung. I would go ahead and talk to Mr. Shapiro and let him know that I'm going to step out of the room for a little bit, and I'll be back in to check on him to make sure he rings his bell if he has any issues. And I'm going to go ahead and exit the room and foam out as I leave. At this point, I'm going to teach you guys how to do the math for the IV piggybacks. Now I'm going to show you how to do the math that we did during the IV piggyback medication administration. So the first one I'm going to start off with is if I have a volume of 100 milliliters and I want to infuse it in an hour, I'm going to go ahead and convert it to the minutes. So when I do this, I want to know how many milliliters I'm going to infuse in an hour because that's what I'm solving for is milliliters per hour to be able to put it on the pump. This is simple, so I have to go through and just do my cross multiplication. It would be 60 minutes per X milliliter, and then this would be 6,000 because I would multiply 100 times 60, and this would be milliliters per minute. Then I would go through and divide by the 60 minutes because I'm solving for X. And once I divide by the 60 minutes, that should then leave me with 100 milliliters per hour. So basically what this tells me is if I want 100 milliliters to infuse in an hour, my rate is going to be 100 milliliters per hour. Now, I'm going to erase this one and I'm going to show you how to do what we actually hung on the IV pump. To go through and do this one, and this is the second problem we're going to do, I know in the problem I needed to give 100 milliliters, but I needed to give it in 30 minutes, which is twice as fast. So to solve this, I want 100 milliliters in 30 minutes. I want to know how many milliliters I need to infuse in an hour, which would be 60 minutes. So in order to do this, I'm going to do the cross multiplication, and I would get 30 minutes per X milliliter, and I would get the 6,000 milliliters per minute over here. I now need to come through and divide by the 30 minutes. And when I do this, X should now come out and be 200 milliliters per hour. And that makes sense because if I fused 100 in an hour, it would be 100 milliliters an hour. If I want it now to go in 30 minutes, I want it to go in twice as fast, which would be 200 milliliters per hour. You can also do this for larger volumes. So I'm going to show you how to do that one, because your piggybacks could very well be mixed in 250 milliliters. So if I go through and I do that one, what I would have here for the third problem, let's say that the order was to infuse 250 milliliters in 90 minutes, and I want to know milliliters per hour. So what I would do is my cross multiplication. I would have 90 minutes per X milliliter, and then 250 times 60 would give me 15,000 milliliters per minute. I would now come through and divide it by the 90 minutes because I'm solving for X. And when I come through and say 15,000 divided by 90, I'm now going to get 166.66 repeating. Now, remember with your IV fluid problems, you know that I must have a whole number here. So I'm now going to round this up to 167, and it would be milliliters per hour. Therefore, I know to infuse 250 milliliters in 90 minutes, I need to set the pump at 167 milliliters per hour. Now I've gone through several different IV fluid problems with you to show you how to set them up as a ratio and proportion and how to solve 4 milliliters per hour so that when you go into the room, you know what you need to set your IV pump at so that it infuses at the appropriate administration time. Thank you very much.